Check, check, check. 1, 2. Testing 1.
I haven't seen her in a long time.
Testing 1, 2, 1, 2.
You should have a little desk.
Yeah, there's no room.
Oh, no matter what. Angle that is. Oh, no, those.
Hi. Hello, hi.
Hi, Lorna. Lorna. Thomas Hutchinson. Hi. I'm Edgerton. Hello, how are you? Good, good. Happy New Year. Yeah. Thank you so much. Watching Soul first thing over there. Yes, there is.
Yeah.
I love it. I love it.
think yours was just recently. I remember yours. I did yours. That's why I remember. I was like, oh, yes. Here you go. You just fold it.
Yeah.
Have my number or Mrs. McGee's number,
Yes.
and I'll. I touched the wrong side. Good afternoon. There we are. Good to see you all. Thank you so much for being here. Some of you are in the room. I hear many are on Zoom, so that's good to hear. And this is a very important and exciting day for us. I'm Tammy Exum, State Representative, 19th District. And happy to be a tri-chair of this wonderful committee, TCB. And I'm here with Councilmember CC Marr and Claudio Altieri from OPM. And saying hello, turn this over to Erica to get us started.
Yeah, perfect. I mean, I think if you are on your computer, please mute your computer. Also, because this is a voting meeting, we do need to have individuals that are appointed to this committee as voting members who are virtual must have their camera on when they cast their vote. So just kind of going through a few of those rules here. And welcome, everybody. Thank you so much. Erica Nowakowski, Executive Director with the Tau Youth Justice Institute, administrators to this committee. Today is a voting meeting, and in your packet, you have a variety of documents that, just so that you know, they're still in draft. There's the and you'll understand why as once we complete the meeting today. But in your packet, you should have your PowerPoint for the presentation today. There is also two sets of documents. There's the recommendations in brief document, which is just the language of the recommendations. The second document is which is actually was sent out via email, was the recommendations justification report, which provides a lot of the content background information, data, barriers, strategies for change, and so forth. In your packet, we've also released the TCB orientation manual. This is a draft document. We welcome all of your feedback as we're still, working on operationalizing ourselves, but this is a pretty good document. Sense of information.
Some of the horse areas.
Please mute yourself. Good information about the operationalization of the TCB. And then lastly, this is actually the second document we have released. Every 6 months, we are doing what we call a highlight report. And it basically, we have a structure in which we do our presentations where what is the topic at hand? What's the problem, or what is the particular area of concern? And we work with those presenters in identifying not only what that specific area of concern is, but also identifying if there's any data that supports what that gap or barrier or concern is, and then any recommendations for how, or strategies for how to improve those barriers or gaps. And so what we do is we do a snapshot of that for the 6 months. And it is a good tool also to use within the work groups and use to help navigate our work throughout the year as to what we need to circle back. So this is actually the second report we have released for the TCB. You can find that on the Connecticut General Assembly website's TCB site as well. And so with that, thank you for allowing me to do that. We are going to call for acceptance of the minutes for the December TCB meeting. Okay, is there a second? Thank you. Any amendments, changes to the TCB meeting minutes for December? Okay, seeing none, can I please get a voice vote for acceptance of the meeting minutes for December?
Aye.
Aye.
Thank you so much.
Aye.
I will give the floor back to our tri-chairs.
Thank you so much, Erica. So this is an important day for us. And for us as a body, and we are looking at making legislative recommendations from TCB. As tri-chairs, we pride ourselves on listening and learning. Today, however, we wish to take a little time at the front here to frame where we've come from, what we've done, and where we hope to go. And let's take a minute to reflect. So much work has been done in the area of behavioral health, and we have a broad array of services and resources in Connecticut. We have dedicated state agencies, a vast network of providers and organizations, multiple advisory bodies who are all dedicated to making things better for individuals and families in Connecticut. So many of you in this room have long known the landscape of children's behavioral health services and resources, and you have dedicated your life to this work. You understand the great need that still persists, however, because many of our children are just not all right. For me, this became personal in 2021 when a loved one was impacted by behavioral health issues and challenges for services and resources that literally took us to another state. I, like so many other individuals and families, became aware of the increase in the needs of youth as we were in the midst of and emerged from COVID. We read about it in the papers, we saw it online, and we were experiencing it in our homes. Feedback and outreach for those in need of help came to the attention of legislators and to the attention of the Speaker of the House, and I was tapped to lead the legislation in 2021-2022 session. This became the top priority of the legislature, which was demonstrated by complete agreement, not a single no vote, on this robust and some said huge legislation called Landmark in both chambers and supported by the executive branch. The commitment was made evident via a $300 million investment by the state, which was a 10% increase over the previous biennial. So what did we, the state of Connecticut, do in 2022? Just to name a few things, we established urgent crisis centers, funded 24/7 emergency mobile crisis services, provided 988 funding, provided respite grants when there was no insurance coverage, looked at social determinants. We provided funding for schools to receive more supports via behavioral health resources as made sense for the school's needs. We created TCB and legislation to make sure that we implemented our work. So what have we done since establishing TCB? We formed and operationalized. We advocated for and received additional funding for behavioral health, including $14 million invested in children's behavioral health system under Medicaid, an additional $8.6 million in 24/7 mobile crisis expansion, ARPA funding for infant mental health, advocated for DCF to allocate $10 million in ARPA for workforce investment and ICAP's technical assistance. ICAPS received a 15% increase, and there was a 3.5% increase for behavioral health codes. We supported the build out of a 12-bed psychiatric medical unit at Connecticut Children's. We were cross-endorsed with the Autism Spectrum Disorders Advisory Council to increase the age of services for ABA services from 21 years of age to 26. We operationalized TCB and developed a strategic plan. We established the services and infrastructure work groups. We supported 4 UCCs and established protocol for ambulances to transport youth to the UCCs. And I'd like to share with you the UCC data points. Since July 2023 through September 2024, there have been 1,470 episodes, which is all of the UCC visits combined. 95.7% of children served in UCCs returned to their homes. 94.1% of families said that they would have gone to the ED if the UCCs did not exist. 99% of children met their treatment goals. This is reflective of our work, the investment, the care, the commitment of children and families of the state to the state, the work being the state, the work being the agencies, the work being the agency leads, the work being you and the community. That's who I'm speaking of, all of us. It takes all of us and TCB learning to work together to continue to build on this progress. I so appreciate the partnership of everyone in this space as we continue to move forward in this work. Thank you.
Thank you, Tammy. That was really great to get that recap and to see how far we've come in this time period. So I wanted to say thank you to the Children's Behavioral Health Plan Implementation Advisory Board. I want to thank them for shining their light and prioritizing this work and allowing us to work alongside them, but also to give us a foundation for where we're going. I wanted to recognize Representative Liz Lanahan for the work she did alongside Representative Exum in 5000 and HB 5001 in 2022. And also to thank all the state agencies in the room and on Zoom who have shown up, who have worked alongside us, who have shared information, who care as deeply by showing up themselves in the room, which is incredible. We know the commissioners are pulled in every different direction, and yet they come to our meetings. So we're so grateful for our relationship with them and their willingness to move forward with us. And also, I want to talk a little bit about the micro and the macro. The fact that we have to hold in both hands these systems, both of which are real, the micro of the one-to-one working with our children, working with our families, the macro of systems that we're trying to fix and make better, and understanding that the funder and provider networks are as deeply invested in this process as we are, as well as the consultants who come to us with their knowledge, their experience, their data, and help us move forward. All together, we are creating a high-performing, stronger system. And I know that right now, there's so much more we want to do as we are looking at recommendations. It feels like just the beginning. And it is just the beginning because we are committed to doing more. Thank you.
Good afternoon, everyone. I'm Claudio Gualtieri, the other tri-chair, and I do also want to start today by reflecting. And I think I have to actually begin with a confession. When we were negotiating 5001, I had great support with DCF and Vin Russo on behalf of the executive branch. I was skeptical that TCB, a board, a body of people coming together, would be one of the most consequential pieces of that legislation. Because as Representative Exum said, 300 million of investment, new service types, filling in the gaps, promoting and expanding capacity at Children's Medical Center that never had inpatient beds. Among that, detailed and intentional way. We have legislators here actively participating, not just as designees, but as active members preparing, reading the materials, listening intently to the presentations. We have the state agencies at the highest level with the subject matter expertise that run these programs and that can help us problem solve in real time. And we have a multi-layered approach. Our work doesn't happen month to month. It happens in between the month with the fantastic work groups. That layered approach and the expertise of Tao that makes sure that everyone has the tools to actively participate. We all come to this conversation with different levels of expertise, different lived experiences, and I think through Tao's operational support, giving us the behind the scenes materials, the training manuals, the background information and justification, we can all meaningfully add our voice, not dominated by the few people who know a program best, but by the people and the consensus of what the needs are for the kids. So I reflect on our work together as being one of the real special and long lasting pieces of 5001 that we all share an obligation to continue moving forward. And I'm going to close with saying that my law school professor, civil procedure, I don't know if anyone went to law school or did civil procedure, but civil procedure is all about the detail. You can't fudge it. Technical details matter. If you don't get it precisely right, you could jeopardize a whole case and it'll cost lots of money. And she said the difference between a daffodil and a dandelion is in the details. And so I want to thank all of you for really putting in the work to do the detail-oriented efforts to get us to really good recommendations, to get us to really good problems that we need to identify concretely and then work to solve. So I look forward to today's deliberation. Thank you.
Okay, thank you, everybody. And now we're going to move forward with the presentation. Really, it's not a presentation, but more so healthy discussion and a vote around the recommendations that have been brought forward. Just a little level setting as well in regards to the core of these recommendations, as was mentioned before by Representative Exum and our tri-chairs. The TCB has received throughout since it's in its first or second meeting and back in October of or September of 2023, we started with some level setting and some significant presentations around different parts of the system, the continuum of care. We've brought forward many dynamic content experts who provided information from EMP, emergencies, the crisis continuum, to UCCs, to outpatient, to inpatient, to in-home treatment and beyond, autism and so forth. It's a variety of different presentations. And with that, as was noted earlier, we have established work groups that have also identified specific work plans and areas that they wanted to focus on. And so these recommendations not only are, not only were they maybe either discussed and or identified at a TCB monthly meeting, but they were also may have been discussed at a work group meeting. And part of the work that we did with the work group chairs is to conceptualize between April and July, what is the work plan? What do you all want to tackle first? What are some of those priorities? As well as based off of those priorities, what are some things that might be viable to bring forward to the TCB to consider as a package of legislative recommendations for 2025? That was all done through April and July. You all in July received a presentation from the TCB work group chairs on some of the conceptualization of what they were thinking about in the sense of possibly bringing to you. In October, we released the first draft of recommendations that would be coming forward from an infrastructure work group or the services work group. Between October and now, actually, even as soon as maybe an hour before this meeting, we have had quite a bit of extensive work where we're meeting with the state agencies and other partners, stakeholder partners inside of state agencies and outside of the state agencies to look at these recommendations and refine the recommendations. You know, some of the questions that we have received at the Tau Youth Justice Institute is, well, wait a minute, here's a recommendation that we didn't discuss in the work group. No, you're correct. Some of these recommendations may not have been discussed in the work group, but were discussed in the larger TCB meeting. And it was identified and decided that they would be vital that we bring that recommendation forward because it's an improvement to our system and a response to our young people in need. And so, so between October through January, there's been a lot of behind the scenes conversations as well as in front of the, you know, conversations around narrowing and refining these recommendations and to ensure that they're viable for moving them forward. And do we have the support and buy-in for moving them forward? So I just wanted to walk you through what that, a little bit of that timeline of what we've done and where we are today. So for the purposes for today, we are going to conduct a roll call. We have a set of recommendations that focus on Medicaid rates, workforce, as well as some other service type recommendations. As noted before, we will conduct a roll call. I have my team here. Paul Klee, who is over there, will be the person that you'll be hearing his voice as he's making, calling your names for each recommendation. We have several staff throughout the room that are also taking tally of each of your votes. And so towards the end of the meeting, before the end of the meeting, we will give the results of each vote instead of taking the pause between each recommendation because, you know, for them to tally, gives them enough time that we capture the information correctly. So before we begin and jump into recommendations, I'm going to ask Paul to do the roll call. Paul?
Sure. So I'm going to call roll here. For those that are in person, please make sure to turn your microphone on when I'm calling roll. And for those who are joining virtually, please unmute yourself and turn your camera on when I call roll. All right, we'll begin. Jeff Beckham. Claudio Galtieri.
Here.
Martin Looney. Cece Marr.
Here.
Matthew Ritter. Tammy Exum.
Here.
Saad Anwar. Jeff Vanderplog.
Here.
Kristen McCarthy Fahey. Heather Somers. Jeanne Milstein.
Here.
Nicole Clarides Detria. Jessica Denegris. Matthew Lesser. Jillian Gilchrist. Stephen Harding. Michael Powers.
Here.
Jay Case. Michelle Anderson. Corey Paris. Mickey Kramer.
Here.
Henry Martin. Ann DeFinius. Catherine Austin. Tony Walker.
Here.
Tammy Nuzio. Javid Sukera.
Here.
Tammy Freeberg.
Here.
Alice Forrester.
Here.
Kai Belton.
Here.
Sherry Shapiro.
Here.
Jan Ponson,
Here.
Howard Sobronsky,
Here.
Mike Meyer, Ashley Hampton,
Here.
Michael Patota,
Here.
Edith Boyle,
Here. Surrogate here.
Jody Hill Lilly,
Here.
Angel Quiros,
Here.
Jordan Sheff, Tammy Venega, Beth Bai, Lorna Thomas Farquharson,
Here.
Charlene Russell Tucker, Cynthia Sohn Moyano, Andrew Mice, Gerards O'Sullivan,
Here.
Nancy Neverett,
Kimberly Caranda here, designate for Commissioner Navarrete.
thank you. Manisha Juthani,
Here.
Andrea Barton Reeves,
Yvonne Pilato here for designee as for DSS Commissioner Andrea Barton Reeves.
thank you. Deirdre Gifford, Christina Guillot,
Here.
Sean King, Gary Roberge,
This is Kathy Foley Guide for Gary Roberge.
thank you. Melvette Hill,
Here.
Carol Bordon, Carolyn Grandel, Akriti Rai, Michelle Scott, Betty Ann McDonald,
Here.
thank you. And the last one. Perfect. That's it. That's the roll. Really quick. No offense to anyone here, just for the expediency of the meeting and calling the vote. We're going to call folks by their first and last name. I apologize. We're not going to call titles, just to get this vote done as quickly as possible. Thank you.
Thank you. Thank you. I just want to know, because some of those have people, the designees.
Yeah, so we called the appointed person through the legislation, and then and we also called whoever they designated. So we called both names.
Okay, I
Yeah.
didn't hear all the designees. Okay.
Yeah,
all right.
no, there, yeah.
I also want to recognize that there's a few individuals online that have joined maybe and missed their spot in the roll call. If we could reflect Tammy Venegay, DDS Commissioner, Representative Paris has joined us. Any others did I miss?
So for a point of clarification also, for if there is the appointed authority and the designee present here, we can only take one vote. So for example, Representative Paris, you have a designee that is, I'm just using an example here, Mickey Kramer. So we need to know for our purposes, who will be casting the vote.
I defer over to the designee of the committee to cast the vote.
Okay, perfect. Thank you.
Thank
And if there's a situation similar to that, another situation similar to that presently right now, if you can please let us know so that we can make sure who we should call. The designee and or the appointed authority. Yeah, Jeff. Yeah, I think you're here as a. Yeah. All right. I think that is all the housekeeping. Paul and my team, are you all ready? Okay. All right, perfect. And we will go a little faster with the name calling now that we have the roll call. All right, perfect. And we apologize also, it may feel a little chunky at times here because we've had to make some adjustments literally an hour right before the meeting. So what you will see in the presentation is the original language. There will be a slide of the original language that was sent out earlier this week. But since then, as I mentioned, within the last 24 hours, we have made some technical amendments based off of some conversations that have been had and meetings that have been had. And so what we did literally less than an hour before we got here is we created a second slide that you do not see in your printed package, which provides the technical amendment language on the screen. So you'll see it on the screen. Okay. And we have various individuals who will be given the floor to present a certain recommendation and some justification for. So again, kind of chunky, but we'll make it work. We'll get through it. So first person up is around the Medicaid reimbursement rates, and I'd like to give the floor to Alice Forrester.
Thank you. And thank you very much for the opportunity to co-chair with Jason Lang, who I think is either on the call or watching. So I'm very appreciative for the Infrastructure Committee and the folks who participate on the Infrastructure Committee. I just wanted to say just one thing, that in meeting with the Infrastructure and Services work groups, these particular recommendations, and the first one in particular, was a mutual recommendation from both the service and the infrastructure work group. This particular Medicaid recommendation from across the board on all of the committees, committee workers was the strong recommendation across the board. Do you want me to read the whole slides or? Okay. Just so the justification also, sorry, I'm the first one reading them, so I'm just getting, okay. So the first point is that the recommendations should not include dollar amounts, and it should be decided through the legislative process. The initial recommendation was basically taken from the phase 1 report, which mentioned a dollar amount, which the recommendation above says that we should not do that. But an important point that was pointed out by our tri-chairs is that the original report, the phase 1 report, did not cover specifically children's behavioral health, and that our mission as the TCB is really particularly around children's behavioral health. And so our recommendation is very specifically related to that group of individuals as opposed to the whole behavioral health recommendation, which was the original one. And two is that there was there are different service codes, as we all know, who bill Medicaid benchmarks, and it was very important that we need to look at Connecticut's codes, and that the report, I think if I'm stating this correctly, only covered maybe 12 of the children's behavioral health codes, and that this recommendation actually covers all of the codes as far as the children's behavior, at least as many as possible. And there's a message in here around the COLA adjustments, and I'm not sure I really understand this as much, but it says there are a handful of places in state statute where the law requires inflation-based cost of living COLAs. However, those increases do not do much without the necessary appropriation. So there is a call for COLAs in the state legislation, but there isn't we don't know how much that would be, and that has to be through appropriations. Is that correct? Yes. Okay. So the recommendation number 1 passed both by the Infrastructure and the Service Committee is that it is recommended that effective October 1st, 2025, the legislature and governor should adequately fund the Department of Social Services to implement an increase of children's Medicaid behavioral health reimbursement rates based on access needs. The children's Medicaid reimbursement rate increase shall include adjustment to meet peer state benchmark rates for children behavioral health, where an application benchmark is available and funding is needed to address access issues. Where a benchmark rate is not available, DSS shall recommend a methodology for equitably distributing rate increases to address any access issues/needs. The second part of this recommendation is the Department of Social Services should conduct an additional Medicaid rate study that specifically evaluates children's behavioral health and compares codes to peer states. The report shall describe how Medicaid investments are reducing the number of codes remaining below the benchmark and evaluating access needs. This study should report the following to TCB by October 1st, 2025. A, the breakdown of children's behavioral health spend and where clinic codes are located. B, after each investment to children's behavioral health, fiscal year 25-26, the Department of Social Services should evaluate if Connecticut is closer to peer state benchmarks on code basis and total spending amount. And C, identify the proportion of the system that was not matched in the Phase 1 Medicaid rate study, and provide the TCB a set of recommendations regarding how to approximate access needs for those codes. So that is the first formal recommendation on Medicaid reimbursement rates for children's behavioral health.
And a point of clarification, specifically for this recommendation of Medicaid reimbursement rates, we are going to need to vote per each recommendation. This is the only one that we will be doing this for. For the remainder of the recommendations, even though they have a subset of them, we're going to vote of them as a whole versus individual sets. But for this one, it was requested that we vote for individual sets. So for now, before we call a vote, are there any points of discussion for recommendation 1 and recommendation 2? Or anything else our tri-chairs would like to say?
Thank you, Erica. Just want to elaborate a little bit on this one. One, over the past 2 years, DSS has conducted a thorough assessment of some of our Medicaid rates and looking at comparisons both to Medicare, where appropriate, and a 5-state comparison average. The hope of that study and the follow-up would be that we would have a data point that could approximate where there may be access needs and where Connecticut's system is performing well and where maybe additional resources are needed. So I'm encouraged by the fact that we're looking to make our rate setting process more rational and focused on the evidence and the needs to get better outcomes for our kids. I also recognize the fact that there's been a large consensus among the work groups that rates and payments is part of the conversation. Having been now deep into the budget development process for the governor's office in conjunction with all of our state agencies and looking at the needs across the entire state budget, I'm going to have to abstain from this recommendation just because of the fiscal impact and the governor's budget still being in preparation, ready for release in February. So with those comments, I'll turn it back.
Jan?
For the children's, for children, what age are we referring to? 18 to 21? I don't know.
It's my understanding from this legislative body, it's up to 18. Is that correct? Or Claudio, please correct.
I think that the understanding is to try to understand where within the framework we can extend to minimize the impact of any cliffs. So where there may be opportunities to go to 21, or if there are different program designs that allow us to go further, I think that's certainly the consensus and the wish is we want to minimize any cliffs, knowing that people will age into the adult system eventually. And I think that's what we intend.
Okay. Any other comments or questions?
Will we need an amendment for that?
My understanding is that it's sort of part of the legislative understanding of how this will move forward. Of course, these are all going to need to be reconciled into legislative text and formally introduced by the legislature to undertake the next leg of policy and legislative development. So I think that we can do so at a later time based on the feedback of what technical pieces can be extended.
Correct. Okay, so we are going to call a roll. Oh, go.
Thank you. I just want to say also, as many people know I support and endorse Medicaid rate expansion and increase, but because I know this is going to have to come before me in the Appropriations Committee, I'm going to have to abstain too. On the funding, just on the funding. Not on the premise, but the funding, sorry.
Correct. Okay. And we will, so we are now going to be voting for recommendation 1 as, and 1A as one recommendation, and then we'll vote again for recommendation 2. So I'm going to ask Paul to please call a vote for recommendation 1.
Perfect. So I'm going to call the vote for recommendation component 1 for children's Medicaid behavioral health reimbursement rates. Claudio Galtieri,
I'd like to be reflected as abstaining from this recommendation.
CC Mar,
Yes.
Tammy Exum,
Yes.
Jeff Vanderpog,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker,
Abstain.
Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes.
Kai Belton,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patoda,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Abstain.
Angel Quiros,
Abstain.
Tammy Benega,
Abstain.
Lorna Thomas Farquharson,
Yes.
Gerard O'Sullivan,
Abstain.
Kimberly Karanda,
Abstain.
Manisha Juthani,
Abstain.
Yvonne Pilato,
Abstain.
Christina Guillot,
Yes.
Catherine Foley Guibe,
Yes.
Melvette Hill,
Yes.
Betty Ann McDonald.
Yes.
Okay, that concludes the vote on recommendation 1.1. Are we moving on to 1.2?
We are moving up to recommendation 1.2. Yes.
Perfect. All right, so we will now call the vote on recommendation 1.2 for the children's Medicaid.
Excuse me, I apologize for the interruption. If I may make a correction to my vote, please. If I may amend it from a yes to an abstain.
Yes, absolutely.
Thank you.
Okay. Just very quickly then, just for as a request, this recommendation 1.2 or 1.2, the Department of Social Services should conduct an additional Medicaid rate study that specifically evaluates children's behavioral health and compares codes to peer state. I won't continue to read the rest. You see them in front of you, but I just want to make sure that that is what you will be voting on next. Thank you. Paul?
Perfect. So we're going to call the recommendation 1.2. Claudio Galtieri,
Yes, noting there's needed appropriations and within available appropriations, but yes.
CC Mar,
Yes.
Tammy Exum,
Yes.
Jeff Vanderpog,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker,
Yes.
Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Kai Belton,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patota,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerard O'Sullivan,
Yes.
Kimberly Karanda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Geib,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you. That concludes the vote for 1.2.
Alice Forrester, yes. You skipped my name.
I apologize, Alice Forrester. Thank you.
Thank you. And like I said, we'll do the tally at the end, results at the end. We'll move forward, Alice, to recommendations 3, 4, and 5.
You want me to read all three of them together?
Yes,
It's
thank
fine. Okay. Recommendation 3, it is recommended that effective July 1st, 2025, that the Department of Children and Families should sustain 24/7 mobile crisis expansion initially funded through ARPA. Recommendation 4, the Department of Social Services should promote Medicaid and commercial billing for UCC services by refining the interim rates established for UCCs as needed and report on provider billing status under Medicaid to the TCB by October 1st, 2025. Number 5, the Office of Health Strategy should submit to the TCB a report on any updates made in commercial insurance plans to reflect UCCs in their plan coverage. The report should be submitted to the TCB by October 1st, 2026.
Thank you. Any questions, comments? Okay, seeing none, we're going to call a vote for each one. I'm sorry, we have to do that, but for each one, just for this set of recommendations for each one. So Paul, call a vote for number 3, please.
Claudio Galtieri,
Yes.
Cece Mar,
Yes.
Tammy Exum,
Yes.
Jeff Vanderplog,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes.
Kai Belton,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patota,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerard O'Sullivan,
Yes.
Kimberly Karanda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Geib,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you. That concludes the vote for 1.3. Are we moving on to 1.4 now?
That is correct. Thank you.
Got it. Okay. Lots of names here. All right. So we'll vote on 1.4. Claudio Galtieri,
Yes.
Cece Mar,
Yes.
Tammy Exum,
Yes.
Jeff Vanderplog,
Yes.
Jeannie Milstein,
Yes.
Jessica Denegre. Oh, I apologize. Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg, Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerard O'Sullivan,
Yes.
Kimberly Caranda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Abstain.
Christina Guillot,
Yes.
Catherine Foley Guide,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you. That concludes the vote on 1.4, and we will move on to 1.5. Claudio Galtieri,
Yes.
Cece Marr,
Yes.
Tammy Exum,
Yes.
Jeff Vanderplug,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes.
Kai Belton,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patoda,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerard O'Sullivan,
Yes.
Kimberly Caranda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Guide,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you. That concludes our vote on 1.5, and I'll turn it back over to the chairs and Erica.
Okay, thank you very much. That concludes the vote for the recommendations on Medicaid where we had to vote on an individual basis. The next set of recommendations we will be voting as a packet set, meaning that we will focus on workforce stabilization as though there are subset recommendations. It is you're voting for a whole set. We do have as a part of these recommendations, we do have other members, not necessarily in the committee, but who have presented to you all, available to answer any questions regarding this next recommendation if needed. So at this moment, I'd like to give the floor to, is it Jan? I think it's Jan. Oh, okay.
My co-chair is listening, but he cannot read right now. So he's asked me to do that. If it's okay, I'll just do a brief on the friendly amendment justification. The first one is making sure that there is the intent of the feasibility assessment recommendation is to design a permissible rate add-on or code to help support the period of when clinical staff are trained in a new model. That is a key pain point that was pointed out when we were hearing from ICAPS, that there's a period of 4 to 6 months where clinicians are trained and yet getting up to speed are not able to bill for the services as they're in their training period. And the second one is that the CCBHP planning grant, which the state received, is to explore different models of community provider reimbursements, including a potential cost-based reimbursement model. And this exercise or work with the CCBHC can be used to look at alternative payment models. And if it's okay with the tri-chair, Claudio, if I could add in there that when applying for this particular grant, the state received confirmation or indication from Senator Murphy that even though CCBHC currently is designed for adults and children, that there would be a way for us to look at having a child CCBHC. Am I stating that correctly?
Thank you, Alice. I know we have DSS representatives on, so they can also add in. So you are correct that in the past, one of the barriers for us participating in CCBHC has been that we have a bifurcated system and we don't have one comprehensive lifespan system for behavioral health. It has been indicated to us that despite our system, where we have children's behavioral health on one side at DCF and the other pieces at DMIS, that Senator Murphy at the federal level will work and help us ensure that whatever waivers need to happen in order to operate under Connecticut's system without blowing up our whole system and redesigning it would be available to us. And I am pleased to announce, if I could, that DSS just recently learned that they were awarded just under $1 million for this grant opportunity. So this will set up a year-long period through the end of 2025. And based on the planning and design that happens and materializes, we would then be eligible, should we choose to apply, in April of 26 for an implementation grant. Even anyone from if the DSS designee would like to add anything?
No, Claudia, how your summary of the CCBHC planning grant is correct. We've just recently received the award for, like you said, a little bit under $1 million, and we'll be working this year to do all the planning and the modeling and the payment, the program models and the payment model design. I think we'll have a better idea in the spring of next year in terms of our modeling and design progress.
Thank you, and thank you for that clarification. The workforce recommendation number 1, it is recommended that the Department of Social Services conduct a feasibility determination and fiscal analysis to estimate adding a billing code to help offset initial costs for onboarding and training clinical staff in evidence-based models before they can bill for services, for example, observation and direction. This should include A, potential Medicaid reimbursement for training and ramp up, where extensive clinical training in an evidence-based model is needed before billing can occur, and B, feasibility assessment and fiscal analysis estimate should be submitted no later than October 1st, 2025. Should I read the second one? Yeah, okay. Number 2, the Department of Social Services should include, as a part of the Certified Community Behavioral Health Clinics, CCBHCS, planning and designing grant the following. A, the development of separately payable acuity-based care coordination services to improve the outcomes of children. And B, a value-based payment model that holds providers accountable and rewards them for improved outcomes. And C, navigation support.
Thank you. And I want to bring to the attention to our tri-chairs that this is one of those recommendations on the workforce recommendation where we did receive some technical amendments. So this is where we're now going to shift to a slide that it's the next slide. Sorry. Okay. Oh, okay. Sorry, Alice. I stepped ahead of you. You still have 2 more recommendations too.
All right, I'll read Workforce Recommendations Point 3. It is recommended that the Department of Social Services and Yale review and design a less intensive level of intensive in-home and child adolescent psychiatric services ICAPS model for consideration. This should be reported back to the DCB by October 1st, 2025. A, such model should consider the needs and time demand placed on families and children and the ability to deliver positive outcomes in a sustainable manner. 4, it is recommended that TCB contract with ICAPS Model Development and Operations, MDO, at the Yale Child Study Center to A, determine what additional federal funding and reimbursement may be available to ICAPS MDO and the ICAPS network as an evidence-based promising practice treatment program, and B, conduct a randomized controlled trial of ICAPS for purpose of qualifying ICAPS as an evidence-based treatment program. Interim recommendations to TCB by October 1st, 2025.
Thank you. That, okay, so there is an amendment to the recommendation, technical amendment, and I'll give the floor to Claudio as well to make any, this is very minor in the sense of it is recommended that TCB contract with ICAPS model development and operations MDO at the Yale Child Study. The specific change is going towards the second line where it says ICAPS network as an evidence one based promising practice treatment program, and the change is and if determined prudent.
Thank you, Erica. And you can see by the explanation here, I think that the prudent step here is to divide this assessment into two. First, we want to take stock of where we already have federal reimbursement for ICAPS, even though they don't have a random controlled trial indicating them as formally evidence-based, to make sure that there may be new and additional pockets of federal money. If that is the case, and it's in the best interest of getting more federal funding and leveraging federal funding, then we would proceed to the random controlled trial. The thinking behind it is before we take a chance of a random controlled trial maybe not proving out the way we all expect it would, I do think that they are evidence-based, but we would have to go through a random controlled trial. We don't want to put at risk any federal funding we currently have if there's not much new that would be attainable going through the RCT. So it's just a little safety valve there to make sure the juice is worth the squeeze, and then we do the due diligence on the front end to make sure that there is new federal money we're actually able to go after.
Okay, thank you. Any questions, comments? Oh, Howard?
Yeah, on recommendation 1, you refer to evidence-based models. Is this being specific to ICAPS or is this a broader statement? And if so, how are we defining evidence-based models? Who's making that determination? And what is the process for establishing that as a basis for reimbursement?
So go ahead, Claudia.
Erica, do you want to start or?
I was just going to say that specifically that this was more directed towards the ICAPS model.
I think that's where we heard the biggest pain point in the ramping up of ICAPS providers, some of the sunk upfront costs, and then a period of time for clinicians where they're in training but not able to bill. And so that was primarily the focus of this recommendation.
I thought so, but the broader statement implies that this would be applicable to other evidence-based model programs that might emerge. And is it our intent to keep it that broad or to be more restrictive to ICAPS?
So what I would suggest, if a friendly, consideration here, is our intention is ICAPS. So when this gets reconciled into legislative language and text, we could maybe do the specifics to call it out and fine tune that piece. Does that work for my co-chairs? Okay. Thank you.
Yes, Commissioner.
Just a point of clarification on the conduct of a randomized controlled trial. Is the purposes of this to suggest that a trial should be conducted, but funding should be obtained elsewhere to conduct the trial, or could that be clarified?
So the recommendation reads that TCB will contract. So TCB, as part of its OE allotment in the budget process, has set dedicated dollars. And the thinking here is when we get our next tranche of money, part of that would be dedicated to, if prudent, doing the random controlled if it unlocks a lot of federal resources for ICAPS.
Thank you.
And then we do have Victoria here. If there are any questions, she's come before you in the past to present on ICAPS and specifically this recommendation. I don't know if you wanted to say anything, Victoria, before we cast the vote.
Sorry. In regards to the randomized control trial, with the wait lists as they are, we have a rare opportunity to do one that would have very limited negative impact on children and families in the state. And it would qualify us federally through a clearinghouse. So this is why we think it's a good idea. Mm-hmm.
All right. Thank you. So Emily, I'm just going to give you the mic because I think you have a correction that needs to be made.
Yes. So for 3, I can insert it. I think the prior version was put in the slides in the recommendation and brief packet that you were all handed out. I'm just going to read the recommendation from there and then I will type it in. It is recommended that the Department of Social Services and Intensive In-Home Child and Adolescent Psychiatric Services, ICAPS Model Development and Operations at the Yale Child Study Center, review and design levels of the ICAPS model for consideration. This should be reported back to the TCB by October 1st, 2025. Such models should consider the needs and time demands placed on families and children and the ability to deliver a positive outcome in a sustainable manner.
Thank you. I just wanted to make sure that we captured that full recommendation because it was slightly missing some of that language in there. Okay. And so now we're going to call a vote for, it's going to be, the recommendation is for, the vote is for the workforce recommendations as a whole. That's inclusive of all of these components here. Okay. And Paul.
All right, so we're gonna take this vote on the workforce stabilization recommendations. Claudio Galtieri,
Yes.
CC Mar,
Yes.
Tammy Exum,
Yes.
Jeff Vanderplug,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes.
Kai Belton,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patota,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerard O'Sullivan,
Yes.
Kimberly Caranda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Guide,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you. That concludes the vote.
Okay, thank you very much. The next set of recommendations is on the autism spectrum disorder recommendation, and I think Alice. So in your packet, you have the original. This is one of those recommendations that has also received technical amendments. And so we do have a revised slide that shows that, but just for preference on the, or for, I think we have plenty of time, so we could do that. Yeah. Yeah, you don't have to go through the whole thing, but yeah. Yeah.
Okay, this is under ASD, Autism Spectrum Disorder Recommendations. Insurance coverage for autism-related services is required on all 50 states. However, the services covered, dollar and age limits vary from state to state. 2 federal laws impacted coverage. 1, Affordable Care Act 2010, and the Paul Wellstone and Pete D'Amici Mental Health Parity and Addiction Equity Act of 2008. Connecticut released 2 bulletins in 2014, HC 96, HC 99, with their interpretation on limiting coverage for treatment by age and cost. The bulletin suggests that age limits are removed for behavioral therapy benefits. However, the age cap is still in statute. CGS Section 38A-514B. Most states updated their insurance policies after the ACA and the MHPAEA laws were released. Several states eliminated dollar and age caps, some just revised. B, according to Autism Speaks 19 states removed age caps. They're including Connecticut in this count, citing the bulletins released in 2014. However, insurance companies are still citing the CT statute that is inclusive of an age cap. And C, New York revised their law in 2011. They maintained a dollar cap but eliminated age caps. They embedded behavioral therapy under a larger umbrella of behavioral health treatment and further defined applied behavioral analysis. And one state law impacted service delivery in Connecticut. That was the special education law, changed in 23, allowing students in special ed to remain in school throughout the year they turn 22. There's now a potential service cliff when behavioral therapy services end at 21, but the student remains in high school in the care of their family. The recommendation, service coverage inequities, no?
Yeah, so we'll pause there.
Right,
We're going to
thanks.
open up the floor. So this recommendation, as I noted, does have some technical changes. I would like to give the floor to Claudio to speak on this. Thank you.
Yes, and with apologies, the original recommendation had one of the wrong statutory references. So this recommendation is supposed to apply to changing the statutes with respect to Section 38A. The one that we had included there was appropriate and included group coverage, insurance group coverage, but in order to be consistent across both individual policy plans and group coverage, we need to include 38A-488B, which is the individual coverage corresponding general statute, and strike the errant reference to 17A to 15C. And then the other technical change to this is, given that there are certain plan designs and rate filings that have to happen, the recommendation is to put it out to align with the plan year, January 1, 2026. That would allow any insurance companies to go through their proper rate filing in appropriate amount of time and then comply with the traditional plan year beginning January 1.
Cool.
And if I could just make one comment, just to reiterate that I also sit on the Autism Spectrum Disorder Advisory Committee, and I spoke with them about this recommendation, and they were very pleased to hear it. And this is one of their legislative asks coming forward, having this change to 26, which would, of course, preferably would be the cap would be removed, but to at least start this process, 26 would be very helpful and desirable by that group as well. Thank you.
We'll open up, put up for any comments, feedback, thoughts? No? Okay. And I think, is this the only recommendation for that? Yes. Okay. So the recommendation language for this is the TCB recommends an amendment to section 38A-514B group coverage and section 38A-488B individual coverage of the general statute section to strike through the age of insurance coverage of ABA from 21 to 26 effective January 1st, 2026. We can call a vote.
Perfect. So we're going to be voting on the autism spectrum recommendation, and we'll begin. Claudio Galtieri,
Yes?
Stacey Marr,
Yes.
Tammy Exum,
Yes.
Jeff Vanderplog,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes?
Kai Belton,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton, Ashley Hampton,
Yes.
thank you. Michael Patoda,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerardo Sullivan,
Abstain.
Kimberly Caranda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Geib,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you. That concludes our vote.
Thank you. The next set of recommendations is on the continuum of crisis services. It's a study recommendation, and I'm giving the floor to Jan.
Thank you, Erica. Continuum of Crisis Services Study Recommendation, Bullet 1. It is recommended that TCB conduct a study to review utilization and anticipated demand of the Children's Behavioral Health Crisis Continuum, which includes 211, 988 mobile crisis, urgent crisis centers, subacute crisis stabilization, and the EDs in order to assess optimal capacity utilization and decisions for which services will be utilized. A, studies should include current utilization of services, marketing efforts, outreach strategies, and resource allocation. B, TCB should submit a report of recommendations by November 1st, 2025.
Questions, comments, opening up the floor?
Just a question, if the study, if it's understood that the study will rely on existing data that's already available for some of those services, 988, mobile crisis, UCCs and SACs have some of this data available. So the study, I assume, would pick up on some of the existing work and data available.
I would say so. I'm looking to my chairs also on this.
I think where there's overlap, obviously we always look to the data that exists. I do think one of the interesting things about this and what attracts me so much to this particular recommendation is we heard from several of the UCC providers, they're still trying to figure out that optimal utilization, especially a big pain point has been in the overnight hours where volumes may not be up. So part of our question here is to find out which of two potential theories could be the case. One, people don't know yet about UCCs and that volumes will eventually pick up across all hours, and that will provide a key component to sustainability. Hypothesis two, regardless of how much information we get, there will be an affirmative decision at certain points and hours of the day where families will choose not to use UCCs, or the referrals that are most common to UCCs aren't available, like schools or school nurses or those professionals. And it's very important for us to understand that so that we can frame up the right policy solution and option. So I agree with you, Jeff, on all the baseline, but I think that's a new piece that I don't know we've quantified yet.
Yeah, thank you for that. I think I do think there is some data that speaks to at least portions of what you're talking about. So I'm happy in collaboration with DCF, who contracts with us for that work, to share anything that we have that can inform that study.
I see Howard hand first. I'll just call it by Howard, then Tammy, and then Javid.
Just another point, when we're looking at data, particularly around the ED, we should be careful not to rely solely on Medicaid claims data, which is what's usually available through Carelon. That only speaks to a portion of the population that's being served. And I want to make sure we don't miss out on those children that are not being covered by Medicaid.
Excellent reminder, and I think it's an undertow that we've tried to pull forward in the recommendations, is to not only look exclusively at Medicaid, that 60+% of people rely on private commercial insurance, and we need to get that data to make the right statement. I appreciate you underscoring that.
I just
Commissioner
want, did
Hill,
you,
yes.
yeah, did you have a data point? I might have missed that, but to your point, I think we're at 41% private insurance. So did you just say that? I don't know if you just said that. For the UCCs, yeah.
Oh, for UCC's
For
utilization, I
UCC.
was talking just generally across the state.
Right, but
Yeah.
for the UCCs in particular, we're at 41% private insurance, so it would be.
That's
to your
great.
point, yeah.
That's a very promising sign.
Yeah.
Thank you, Commissioner.
Tammy?
Well, I just want to affirm that I think this is a really worthy recommendation. And I think it's implied, and I think, there will be work to be done after today, but I just wanted to express my hope that the scope of the review, there's a reference to marketing and outreach. I think that scope of the review should really also include explicitly the referral pathways, because I think that's important when we think about the coordination across the continuum of care.
I think that's an excellent point, and there's so many opportunities for that, especially when we look at the schools, for example. There are just so many opportunities. So certainly that will be something we'll incorporate. Thank you.
Javid?
Yeah, I also support the recommendation. I just want to highlight, though, that we need to think a little bit more broadly in terms of the continuum of crisis services. There's a lot of urgent care centers where people present with behavioral health concerns that aren't behavioral health urgent care centers, things like urgent care that are more medical. There are also crisis text lines that exist in various specializations, such as faith-based communities and others that aren't captured by the scope that's defined. I recognize that that's not something we can always capture. I just think it's important for us to acknowledge that. And the last point I would say is it's really important that the study also include data regarding race and ethnicity, sexual orientation, gender identity, as well as social determinants of health, because the trend we've seen nationally with things like urgent care for behavioral health is that they tend not to be utilized by communities of color who end up overutilizing emergency departments instead.
All right. Thank you.
It's always tricky, I imagine. Erica can add to this. It's always tricky adding and committing to scopes of work because some of this is subject to the RFP and how much funding is available and how far we can get. But I think your point is a friendly one that we certainly conceptually agree with.
Okay. Sorry about that. Yeah, casting votes. Okay. Okay. So at this moment, just for a pause there. In the sense of the scopes of work, just this gives us a little bit of second here. With scopes of work, we do have a process for this in the sense that we do not design them. So we design them in collaboration with whichever entity is been contracted to do the study. And that is vetted through the chairs of the committee, maybe vetted through work groups and so forth to ensure we've captured the right information for that study. What are we looking to answer? And so that is designed. And so if there's other elements that or data indicators that need to be identified through that study, we can also expand on that through those through that process of designing the study. So we can do that. Okay. So I think, Paul, if you don't mind, sorry, Senator Austin, we're going to call a vote right now for the Continuum Crisis Service, but I know that you want to cast a vote. So do you want to do that? Okay.
All right, so we will begin calling the vote. Claudio Galtieri.
Yes.
Cece Marr.
Yes.
Tammy Exum.
Yes.
Jeff Vanderplug.
Yes.
Jeannie Milstein.
Yes.
Jillian Gilchrist.
Yes.
Michael Powers.
Yes.
Mickey Kramer.
Yes.
Catherine Austin.
Yes.
Tony Walker. Javid Sukera.
Yes.
Tammy Freeberg.
Yes.
Alice Forrester.
Yes.
Kai Belton.
Yes.
Sherry Shapiro.
Yes.
Jan Ponson.
Yes.
Howard Savronsky.
Yes.
Ashley Hampton.
Yes.
Michael Patoda.
Yes.
Edith Boyle.
Yes.
Jody Hill Lilly.
Yes.
Angel Quiros.
Yes.
Tammy Venega.
Yes.
Lorna Thomas Farquharson.
Yes.
Gerardo Sullivan.
Yes.
Kimberly Caranda.
Yes.
Manisha Juthani.
Yes.
Yvonne Pilato.
Yes.
Christina Guillot.
Yes.
Catherine Foley-Geib.
Yes.
Melvette Hill.
Yes.
And Betty Ann McDonald.
Yes.
Thank you.
Thank you so much. The next recommendation is on the school-based health center study. You may recall that back over the summer, we had some also extensive presentations, not only from districts, but also from the school-based health centers. And it came before you to present regarding services, behavioral health services within the school or outside of the school and their collaboration. So with this, I am going to give the floor to Jan.
School-based health center study recommendations. 1, it is recommended that all school-based health centers, SBHCs, report to DPH the following effective October 1st, 2025, annually thereafter. A, establish a comprehensive reporting across all SBHCs to inform targeted investment. 2, it is recommended that TCB contract with an outside entity to conduct a school-based health center study for A, improving transparency and accountability of Connecticut's SBHC services by implementing a standardized statewide data collection, reporting, and QI process for SBHCs across all services. B, a review of Medicaid and private insurance billing codes e.g. ESS billing in schools to ensure non-duplicative billing and opportunities to fully claim reimbursement for services provided.
Thank you. And as this is one of those recommendations that we did receive some proposed technical changes to this recommendation, I'd like to give the floor to Commissioner of Department of Public Health as well as Claudio. And we do have some non-members who have been working with us on this recommendation who are available for answering any questions. Commissioner?
Thank you very much, and thank you for this recommendation. We appreciate the vote of confidence of DPH being the agency to collect such data. However, a few suggested changes are that the study that is proposed be conducted first to identify the data elements that should be part of a data collection tool going forward, which would provide this opportunity for transparency and accountability. But I think if we have the opportunity to identify what that standardized statewide data collection instrument looks like, what the reporting would be like, and what the QI process would look like, I think that would be an important first step. In addition, as part of the study, we would like to have a standardized definition of school-based health centers. There are many providers that provide care in schools, but are not technically a school-based health center, which requires a much more robust infrastructure to be set up so that we can compare apples to apples. We think it's very important as part of this study to have a clear definition of what a school-based health center is, what the data collection instrument might look like, and that part of the deliverable of this contract would be to actually have a data collection instrument really be part of the final deliverable. And I think with that, we believe that the Connecticut Association of School-Based Health Centers and DPH should have a seat at the table to be able to inform the study and that data collection instrument. So having said that, I think if the study is conducted first, that would then be able to feed into the recommendation 1A so that DPH would collect these data upon the completion of the study, and that it would then be relevant to those school-based health centers as defined per the deliverables of the contract. And so the effective date would be after the completion of the study. Thank you.
Claudio?
I just want to commend especially Commissioner Giuttani for her leadership in trying to forge a compromise here. There was some very good feedback provided by the school-based health centers on we need to lay the foundation, get a clear definition, get some of the pieces collaboratively in order. And I just want to appreciate that that's part of the great process that we have here is we're pre-vetting those things. We're not just lobbing something that hasn't had the benefit of good conversation and socializing it with all the key partners involved. And that's a great example of the connections that TCB can help bridge. So thank you.
Alice?
Commissioner, thank you so much for that recommendation. I had the honor of sitting with most of your committee on the PA 2135 and a few other legislative reports that were written for the school-based health centers. And there was a very good definition, I think, put in that report. And it talked about school-based health clinic, under the DPH funding, because a school-based health clinic gets some funding from DPH for underlying the behavioral health services that you might, it goes through, I think, the district and then to the providers. Whereas those of us also who are doing both, delivering healthcare funded, some of which through DCF or and Medicaid in the schools that are not under the particular license, I would hope that we don't limit the conversation, or if we're just studying the school-based health clinics first, we should actually then make sure that we include these, I think we called it extended school mental health services, as a way of making sure that we're meeting the guideline, that we're having outcomes, that are well in helping our kids and families. And then the third sort of a little bit of confusion in this is, as and maybe I'm wrong, is that the school itself does bill Medicaid, right, for behavioral health services that are often associated for IEPs, right? So those dollars are, and those things are changed. Those things are followed through the IEP process, I would assume, versus the mental health services that are delivered for non-identified children for special ed.
So I do want to comment, sorry, I do want to also clarify that in the original language of the recommendation, that last section that talked about the the billing situation there that you're talking about, we did decide to split that and make it a standalone recommendation, which we'll get into next, so there we can have some more clarity and better understanding around some of what you're talking about, Alice, around the billing piece. But Commissioner, just.
Yeah, I was just going to add that I think to get a comprehensive view on what behavioral health services are being provided in schools, it may make sense to collect that, but as two separate identities so that it's clear what a school-based health center is actually providing and what providers are providing, and to have that clear distinction so that where that definition may be is, part of what the final report is, but also qualify what those other types of providers might be so that that data is collected.
Those providers are often working under their outpatient license through DCF, right?
Jeff?
Just one thing to add to that, in collaboration with DCF, we're working on a landscape analysis of school mental health services, which is inclusive of both the designated school-based health centers, but also the other designations that Allison, you were mentioning. And that's another area where, again, in collaboration with all of you or partners at DCF, we'd be happy to come in and talk about the results of that landscape analysis to inform the refinement.
Commissioner?
Just so I'm concrete, so DCF respectfully requests to be a part of whatever committee, so that because of our nexus to the licensing processes for our BCCs.
Perfect. Okay, thank you. All right, any other comments, questions? No? Okay, we will call a vote for the school-based health center study. And as noted here, it is recommended that TCB contract with an outside entity to conduct a school-based health center study for the purposes of 1A, developing and administering a survey to better understand current data collection practice and anticipated challenges and opportunities in implementing a more robust data and QA system. B, the study will be designed and piloted in collaboration with the Department of Public Health. I understand Department of Children and Families. And then C, a standardized definition, as was noted here, for the school-based health centers. Okay, we will call for a vote. Paul?
Perfect. Claudio Galtieri,
Yes.
CC Mar,
Yes.
Tammy Exum,
Yes.
Jeff Vanderplog,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Catherine Austin, Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes.
Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Savronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patoda,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerardo Sullivan,
Yes.
Kimberly Caranda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Guide,
Yes.
Melvette Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you.
Okay, thank you. So the last recommendation on the packet is around, sorry, Rep. Walker, I know. The last recommendation is that in the original, in the In the original school-based health center study, there was, as Alice had mentioned earlier, sort of a 2B, a review of Medicaid and private insurance billing codes. For example, ESS billing in schools to ensure non-duplicative billing and opportunities to fully claim reimbursement of services provided. So we decided to pull that out and make it a standalone recommendation. Now, the question at this moment, in which we don't have an answer for yet, but we'll get through it, is like who would we be partnering with to do that? But at the heart is this one recommendation to do a review of this and assist schools and districts.
To this, just question, when it was said before that we need to define what the school provides and what SBHCs provide, would this also fall within that recommendation so that we're getting clarity, not just on billing, but also on provision, service provision?
That's a very good question, and
I think that information is held by the IEP process, and I'm not sure if the Department of Ed holds that particularly. So I think that is an area that would have to be a little more explored. Maybe DSS has that information in terms of what's billed from the different districts.
It just seems that it is important to determine as we're looking at what's being provided and who's providing it.
So is your suggestion, Senator Moore, that we can still, that would be one data indicator in the design of this study instead of doing a separate type of study?
Yes, definitely.
I saw Rep. Walker's hand up.
Yes, could you just repeat the question? Because I think I know the answer, but I wasn't exactly sure on the question. Right. Right.
Who would we be sort of partnering up with to work on this? And I think what Senator Marr is suggesting is maybe that be a data indicator within the study of that we had just approved on the school-based health centers.
Yeah, I mean, I would also, the fact that each school district has that ability and they're all independent entities. I would probably recommend somebody from DSS and SDE to be part of that team to make sure that you cover both bases, because I think they would be the ones to help, because each school district is going to be a different pattern, and I think you're going to have that.
Simply want to make sure that we're capturing it as we're being careful about this. Want to make sure that we somehow capture what was brought up previously.
Okay. All right. So if I think what we can do is, since we still have some modification in the sense of the language, and can we vote on the concept of it and then not necessarily, the specifics around the language? Does that? Okay. All right, so we're going to call a roll call for voting on the concept of doing more exploratory review of insurance billings, for example, ESS billings in school, and ensuring non-duplicative efforts. So just a quick roll call, Paul?
Perfect. Claudio Galtieri,
Yes.
CC Marr,
Yes.
Tammy Exum,
Yes.
Jeff Benderplog,
Yes.
Jeannie Milstein,
Yes.
Jillian Gilchrist,
Yes.
Michael Powers,
Yes.
Mickey Kramer,
Yes.
Tony Walker, Javid Sukera,
Yes.
Tammy Freeberg,
Yes.
Alice Forrester,
Yes.
Kai Belton, Sherry Shapiro,
Yes.
Jan Ponson,
Yes.
Howard Sovronsky,
Yes.
Ashley Hampton,
Yes.
Michael Patota,
Yes.
Edith Boyle,
Yes.
Jody Hill Lilly,
Yes.
Angel Quiros,
Yes.
Tammy Venega,
Yes.
Lorna Thomas Farquharson,
Yes.
Gerardo Sullivan,
Yes.
Kimberly Karanda,
Yes.
Manisha Juthani,
Yes.
Yvonne Pilato,
Yes.
Christina Guillot,
Yes.
Catherine Foley Guide,
Yes.
Milvet Hill,
Yes.
and Betty Ann McDonald.
Yes.
Thank you.
Okay, thank you. And I will ask Paul to read the results of all the recommendations. And just to confirm, we do have a quorum. We needed a quorum of 25. We do have a quorum above that. Thank you.
Perfect. So for the first Medicaid recommendation, it passed with 21 yes, 0 no, 11 abstain, and 16 not present. The second Medicare recommendation passed with 32 yes, 0 no, 0 abstain, and 16 not present. The third Medicaid recommendation passed with 32 yes, 0 no, 0 abstain, and 16 not present. The fourth Medicaid recommendation passed with 31 yes, 0 no, 1 abstain, 16 not present. And the fifth Medicaid recommendation passed with 32 yes, 0 no, 0 abstain, and 16 not present. The workforce stabilization recommendation passed with 32 yes, 0 no, 0 abstain, and 16 not present. The ASD recommendation passed with 31 yes, 0 no, 1 abstain, and 16 not present. The Continuum of Crisis Services Study recommendation passed with 32 yes, 0 no, 0 abstain, and 16 not present. The School-Based Health Center Study recommendation passed with 31 yes, 0 no, 0 abstain, and 17 not present. And the School Health Services recommendation passed with 31 yes, 0 no, 0 abstain, and 16 not present. And 17 not present. I apologize. And that is the vote on all of our recommendations. Thank you.
If I could just ask for a repeat on the first one, I did not hear that one. My apologies.
Sure. The first Medicaid recommendation.
Yes, 1-1.
The first Medicaid recommendation was 21 yes, 0 no, 11 abstain, and 16 not present.
Thank you.
Sure.
All right, I'll give the floor to our chairs if they have any closing remarks.
Did that pass?
Yes, I think it, yeah, Paul, did that passed, right?
Yes, yeah,
Yeah.
we did have majority vote on the first one. Thank you.
Yeah.
Okay, thank you. Not to reiterate the points that I made before, but I just want to say we just worked through recommendations and amendments and changes beautifully. I just want to say, and you all deserve a serious round of applause because I know that it was frustrating in that some of the working groups, some of the recommendations didn't show up as you had originally presented them, but you trusted us to work through it with you, and we trusted you to work through it with us. And I think we've come out to a very good place. So I would like to give you a round of applause. And I will pass it to my tri-chairs.
I just want to say thank you. I find this to be very exciting. I know it's a long process, but it feels wonderful that we have cohesion, we have direction, and we will continue to do good work collectively. And I just thank you so much for your hard work, your partnership, your trust in us, and we're learning so much from you and with you. So just thank you very much for this. This is wonderful. Thank you.
I'll just add very briefly, I think that this is the beginning of the end part of the phase. So all that energy you brought today, we're going to need it for this next several few months. But I know that this group is committed to sticking it out, and we'll get there. And hopefully we'll have some really nice things to celebrate come the summertime. Thank you.
Thank you. And Claudio, you read my mind because I was going to say this is just the beginning to another chapter. So the next, just for big picture process steps for you all to know, we will be working with your legislators here, your chairs here to then further define the bill. I mean, I know I'm looking at my chairs here because I know that part of our discussion was that this any bill coming forward from this committee would go through the Children's Committee, will begin there. And as this bill does have some appropriate appropriations assigned to it or some, request from appropriations, it would then need to also go through the Appropriations Committee and so forth. But as the Tao Youth Justice Institute, part of our job is to produce a couple things for you all. One, you will be continuing to be inundated with emails around some fact sheets. We will be sending you fact sheets. We are not lobbyists. There's nothing wrong with lobbyists, but we are not lobbyists. We are here to inform and educate and ensure that this, recommendations move forward. So we will be circling back with many of you in the sense of, the drafting of the bills and so forth, the language specifics. But we will also be producing fact sheets that we will be releasing not only to this committee, but to the general stakeholders who may be interested in testifying and supporting this bill in public hearings. We will also be releasing some documents that, if you have not had an opportunity to testify, what does that look like, sound like, what do you need to do? We will also be letting you know when this bill is called up for a public hearing. So those kinds of information, because we want to ensure success. We want to get it through. So it is our job to keep you informed. And so that is the phase that we at the Tao Youth Justice Institute will be moving towards. Okay, thank you, everybody. Our next meeting is scheduled currently at February 5th, but I want to add a caveat that I know that our legislators are in session, so keep an eye on our emails in case we have to schedule or reschedule. Oh, sorry, you already know we can't meet on February 5th?
That's the budget day.
Oh, that's
what you're
budget day.
saying.
That's
Yep.
right. See, we already know we cannot meet on February 5th, so we will be sending out a rescheduled date. Thank you, everybody.
Thank you to Tao Justice and you, Erica, for all your work bringing all this together.
You have a little extra time, right? Are we all set?